I lost my hearing when I was pregnant with my second child. I was telling my husband that, baby, I've lost my sense of smell. I can't smell anything.
Pregnancy can give you cancer. I repeat, pregnancy can give you cancer.
The society is deliberately lying to women about pregnancy and motherhood, and you cannot convince me otherwise. Because nobody tells women pregnancy is life-risking.
Between 2015 and 2017, there were 209 reported maternal deaths. This is from a research by the Oxford University. And then you'll be wondering, okay, maybe the next few years, this number should reduce because there's advancement in technology, there's lessons learned, and seeing that we have been giving birth for time immemorial, you'll be thinking that this number should gradually and consistently be reducing. But you'll be sorely mistaken because in 2021 to 2023, the maternal deaths increased to 254 maternal deaths recorded, which is really, really sad and pathetic. Yeah. So over the couple of years and over the couple of months, we've been hearing the birth rate decline across all the first world countries, from Japan to US to UK. And last in my last video, I covered the economic reasons why the birth rate is decreasing. So I'll have that pinned somewhere up there. But in this video, I'm going to be talking about the biological, or you can say the physiological reasons why the birth rate is decreasing, why women are deciding to opt out of pregnancy. Welcome to Tea with Tokwase, where I serve you the hottest tea on the internet, from TikTok, YouTube, Reddit, and sometimes X. If this is your first time here, welcome. And if this is not your first time, welcome back to the channel. I hope you get very comfortable and also just hit the subscribe button to support me on my journey. Thank you so much. So, without further ado, let's get into this.
I've been summoned. Hi, I'm the girl with the list, and this is reason 317. I am not having kids. So this mom recently posted this video of what the pregnancy hormones did to her face. What I can tell what's happening here is similar to pregnancy nose, which we've talked about before. From what I understand, pregnancy nose happens when the estrogen levels in your body increase, and that makes your blood vessels dilate to increase blood flow. And so in soft tissue areas like your nose, that makes them get bigger. So that's what's happening to her, but in her entire face. Whether that's because she has more soft tissue in her face, or maybe she has higher estrogen levels, I'm not sure. But this is certainly something I have never seen before. She did post an update. I translated some of the things that she said. I'm gonna read it to you. The picture I posted is real. My face started changing when I was 2 months pregnant. I noticed that no matter what skincare I used, it wouldn't work. I got pimples every day, and it looked like I had a sunburn. My face looked older. The closer I got to the due date, the worse it would get. You know this will pass because it's just pregnancy hormones. So new mommies or anyone out there like me, don't worry. It gets better. Once you give birth and your body stops producing those pregnancy hormones, the swelling goes away pretty quickly. I think this is a really good example of just how intense those pregnancy hormones can hit you, and how they can make your body go through just insane changes. It was obviously really vulnerable of her to post this. So glad that her treatment is going well and that she's getting her confidence back. I will be taking my birth control.
I've had a lot of people asking me why and how I don't have teeth at the ripe age of 33. Well, let me tell you, it's because of kids. All right. I was pregnant with my daughters, and they took all of the calcium out of my body. Not only did they take the teeth out of my head, but they did help me out a little bit by taking calcium deposits that I had all around my body, like in my fingers and in my toes and in my knees. I initially went to the dentist a few years ago. I went to Aspen Dental, and they told me that it was going to be $28,000 to fix my teeth. I did not have insurance at the time, so I told them to yank those suckers out. I did end up having a bad feeling about Aspen Dental after the fact, and I went to a different dentist, and they're like, yeah, no, you shouldn't have had them pulled. We could have done better. Are you fucking kidding me? I have been consistently losing weight over the past 3 years because I can't eat shit. I'm stuck on a retirement diet where I can't eat anything other than the shit that I can mush with my tongue. It's bullshit, and I am hungry and cranky. I have been without teeth for 10 days. I was able to wear my top dentures for the first time all day without any discomfort yesterday. I took them out of my head for 30 seconds and my dog ate them and still hasn't shit them out. I just want a steak.
I tell you, these women are going through it. Going through the most. The dog ate it too. I did not see that coming. Oh my God, this is so sad. This is so sad. Just to give you more context, I'm not trying to sway you to have kids or not to have kids. I'm just bringing up people from the internet. Just by the way, I am child free. I've been child free consciously and actively for the past 3 years. That's not changing. Nothing change. Not going to change my mind about that. So I'm out also contributing to the birth decline rate, and I'm also congratulating myself for that. So this video is going to have an overlap. It's going to be basically an physiological and biological, but you also hear some hints of economic and maybe social reasons, which will be my next video. Social reasons why people are deciding not to have children. So there's going to be quite an overlap, but the majority of the videos are going to be biological or physiological or medical reasons why some women are opting out of childbirth.
I lost my hearing when I was pregnant with my second child. And in my head, I thought, that's the worst that can happen. You know, what more? What more is there? Recently, I posted a video on YouTube. And I was talking about how, I've had catarrh for the longest time. It's very severe. And so if my voice is weird, they should please, just understand. Somebody in the comments was like, Maraji, do you think you have pregnancy rhinitis? I first wait first. I say, which one be pregnancy rhinitis? I had to go and do my research. Guess what? Lo and behold, I do have pregnancy rhinitis. Guys, let me tell you something. It is the... What you be hearing? What I want to do? Get with him now. They talk. What I want? What's it for? I can't breathe. I'm not able to breathe. Yesterday night, now cry now. I dey cry. I no fit sleep. Why? I no fit breathe. I no fit breathe. My nostrils are blocked. I was telling my husband, see, I don't know, say na pregnancy, but I know. My third child. I never experienced that before. This is my first time. I was telling my husband that, baby, I've lost my sense of smell. I can't smell anything. Food go dey burn. What the one that's in the coronavirus I get, I'm waiting on the app. I can't lose my, even the time when corona days, if I don't get corona, I never experienced that before for my life. So waiting on the happen. Pregnancy rhinitis. My God, I beg. One doctor, I remember I saw a doctor on TikTok. We can they talk say, oh, it has not been well researched. They are still researching. Hey God. 2025 and I never research and finish. Yesterday night, sleep they catch me, I don't feel sleep. I don't feel sleep because my nose don't block. I'm not saying one nose or my whole nostril, everything is gone. Now mouth I used to breathe now. God.
Hi, so it's taking me a lot of courage to make this video. Yeah, and this is something that can happen to anyone. In fact, what triggered me to do this is because of a particular content creator I saw talk about her. She lost her sense of smell in pregnancy. Well, that's how mine started in 2014. I was pregnant with my first daughter. At that time, I didn't take it seriously. I would realize that my husband would come back and tell me, something is burning, can't I perceive? And then I noticed I couldn't perceive, but it later came back on and off. It was permanent for a while. Fast forward 2020, I was pregnant with my son, my third pregnancy at that time. I was admitted for very high sugar level, high blood sugar level. At that time, it was said I had gestational diabetes, and at the hospital they were treating me for that, insulin and all of that. I started experiencing this severe migraine on this side of my head, and so they started deliberating, what are they going to do? They took me to an eye clinic just close to the DSS hospital where I was at that time, and the lady was like, I should ensure I do an MRI at that time. So I was taken for an MRI with serious deliberation because I was pregnant at that time, and some scans are not really wise to do while pregnant. But I had to do that scan because the severe headaches were too much. Yeah, and I was taken for the MRI, and prior to that time, at the clinic there, I was eating. I didn't even know I'd lost my sense of smell. I was eating fish. The fish was given to me the previous night, but was not ready to eat at that time. So I was eating it the next morning only for a nurse to come in. I was like, madam, can't you perceive this? It's not good. The fish is not good. It's not smelling good at all. It's not. That's when I realized, oh, my sense of smell had disappeared again. At that time as well, all this time, no doctor decided to ask me, okay, what's wrong? Is this happening to you or not? I was congested nose. I couldn't perceive at that time. So those were trigger signs, but didn't care about that at the time. I was rushed for the MRI. MRI showed I had run sinusitis. That had to do with my nose. My nose. There was a lot of build-up in my sinuses. So I was asked to go to a different hospital because that hospital couldn't manage me at that time. They took me to Nisa Premier. While at Nisa Premier, I spent a week. The ENT that admitted me, I never saw him till I left. I was there for a week. They just kept me there doing nothing, and it even got worse because before I left that first hospital, I was able to still see or seeing a little bit. You know, it hadn't gotten to that point. But by the time I was taken to Nisa Premier, time had passed. They never came to see me, and eventually when I got to see the visiting consultant, he was like, if I like, we should not start moving to National Hospital as fast as possible, which we eventually did. We didn't even have time to start arguing or accusing him for delaying us at that time. So we rushed to National Hospital, and there they were like, oh, they have to operate on me and remove the build-up of mucus on my nose, and they have to scan my face. At that time, they had not told me that, but they had called my mom aside and my husband aside to tell them. But my mom was like, oh no, she doesn't want her daughter's face to be scanned. No. My husband was like, if anything that they have to do for me to get better, let them do it. You know, immediately they took me to go do the surgery of my sinuses. Getting there, I was already seeing it. A lady had already passed because I noticed her hands were dangling. They were just wheeling her out of the theater. Her hands were dangling. They covered her hair, but I could still see her hairstyle, making me know it was a woman. You know, she had just done surgery, an ENT surgery at that time. I was scared. Looking at my left, there was a boy they were trying to revive. They were trying to wake him up. He just finished surgery as well. I said, God, I'm in your hands. I was so scared. But I had a lot of people praying for me outside. My husband, my family, my friends, everyone was praying for me at that time. And I entered. The first thing I saw was generator. They were turning on generator while operating me in the theater there. They had to use generator. Like, God, Nigerian healthcare system is really poor, I must say. I woke up, you know, and thank God I was fine at that time. That's what I thought. They wheeled me back, to the ward, and thereon, not like he'd resolved. My eyes were still bulgy. I had to go back a couple of times. They would stitch my eyes in. I'll put up a picture so you can see. They would stitch my eyes together to try and push my elbows in. At that time, I didn't really still get an ENT proper check. They just did surface, not knowing that this thing was heading to my brain. An infection, a minor infection that should have been done just when they noticed that, my eyes were getting swollen. I had not lost my sight at that time. You know, this was a little surgery. It can happen to anyone, by the way. Anybody, not just a pregnant woman. Anybody, but when you're pregnant, immunity is a bit low. It was time for me to give birth. I noticed I was bleeding. In the night, I woke up my husband. He was like, we have to rush to the hospital. I was like, I could manage. It was 2 a.m. in the morning. Everyone was dark. Abuja roads are not really safe at that time. But he insisted. Thank God he didn't listen to me, sorry. Because as we were arriving in the hospital, the pain took another turn. I was bleeding. I was in severe pain. I was wheeled for a scan. I didn't even know what the sonographer was telling my husband at that time. But by the time they took me back to the ward, I was trying to stop the bleeding. I noticed his face, you know, I obviously knew there was something. He couldn't even hold back his tears. He told me there was no heartbeat. They couldn't find a heartbeat on my son. After all this that happened to me while I was pregnant, I eventually lost my son. Someone I was really hoping to meet. Like, I felt both of us have been through a lot, and we have conquered the world together. But it's not something I wish for anybody at all. I had to go and have a C-section at that time. And they apologized, but well, it's to save my life. And they brought my son out looking very healthy and fine. Apparently, I had placenta abruption. That's another dangerous condition that can happen to a pregnant woman is between life and death. I would have lost my life that night, but God spared me because my placenta detached, so that what was causing the bleeding and led to my son passing away as well. Yeah, but I thank God in all of this. So why am I making this video? Please, I needed to get to this particular content creator. Most of you will know her. She just spoke about it some days ago. I can't remember her name or what her name even starts with, but I follow her, but I can't just keep up. I couldn't keep up with her name. I looked for her to try and get this video to her, but I can't. But if you know her, please, she just spoke about losing her sense of smell. That's how mine started. It started as sense of smell. I took it for granted. Losing my sense of smell, I took it for granted. Congested nose, I've been having that before I even got married. I thought, yeah, it was allergies, so they said, but I didn't know it could lead to me losing my sight, even a drooly eye. Like, nobody knows this about me. Usually I'll use my hairstyles to cover my eyes, yeah, or wear tinted glasses, you know. But now this might just be what would save someone, because I'm noticing it's becoming more and more rampant. If someone had told me that it would lead to this, probably I would have taken care of, yeah, any ENT thingy, sense of smell, and all of that. Congested nose, I wouldn't have gotten to this. I wouldn't have lost my son at all as well, you know. But anyway, I thank God for the gift of life. Please follow, like, share, so it could get to her as soon as possible. Thank you so much.
Yeah, so the creator she was talking about was Maraji, which was a lady that we just played before this one. The lady with the blue top, saying her first pregnancy, she could not hear. She lost her sense of hearing. The way she just passed by it, like, oh, it's not a serious thing. Like, I don't even want to be hearing. What are people talking about that is serious for me to hear? She passed that one, and then she's now losing her sense of smell, and she was also going to let that go as well. Yo, I don't even know if we don't take this thing very seriously, because even pimple, they say don't even pop pimple around, which just around your head or around your face. They say don't pop. You talk less of, you have lost your whole sense of hearing, your whole sense of smell. How many senses again are remaining for you to use? The way she was not even taking that thing seriously was even scaring me too. Her third pregnancy. But anyway, as she said, this is something that not many people know about. It's surprising that even the doctors in this case let it get to this extent. And look at how beautiful her eyes. She has really, I like looking at people's eyes. They're like the best like thing for me to see. People's eyes are so beautiful. It's so sad for her to be deformed permanently, and she didn't even get the child. Anyway, let me move on to the next one.
Pregnancy causes a lot of physiological changes, and one of the aspects that's not talked about enough that affects about 1 in every 3 women who go through pregnancy is something called rhinitis of pregnancy. It's almost as if you get new allergies or worsened allergies that can be quite uncomfortable. I'm Dr. Ruben. I'm a board-certified allergist, and I'm going to teach you more about this. If you want to learn more about allergies, hit that follow button for more information. During pregnancy, about 1 in 3 women will experience worsened symptoms of their nose. 1 in 3 will have no change, and actually 1 in 3 will have better symptoms during pregnancy, and it gets better about 2 weeks after delivery. We don't really know why this happens. A lot of people believe that it's due to hormonal changes from estrogen or progesterone, but there's not really a lot of evidence to support this. Symptoms can be quite severe and very difficult to treat, especially because conventional medications don't work that well. So I'm going to go over 4 tips that do not involve medications to help with managing rhinitis of pregnancy. First, exercise can be beneficial because as you move, your sympathetic nervous system activates to help clamp down on blood vessels that are in your nasal passages to act as a decongestant effect. Next, positioning your mattress at about a 45-degree angle or propping your head up at night may help your nose drain while you're sleeping. Also, using a humidifier at night in your bedroom may help relieve some of the nasal congestion by loosening up the mucus that's in your nose. Lastly, I am a big fan of rinsing out your nasal passages with a saline rinse bottle or neti pot so that you can get rid of the mucus that builds up in the nose to relieve some of that congestion. Just make sure that you're using distilled or previously boiled tap water whenever you're doing this. I hope you found these tips helpful. If you have any further questions, leave it in the comments section. Follow for more information.
Y'all, so this lady got pregnant right at 28, and this is what the baby did to her. I'm sorry, but I would have to sue that man and that damn baby. She had to be allergic to the man, the baby, or both. I don't know, it just looked like an allergic reaction to me. It really do look like an allergic reaction. I ain't even trying to be funny. Every damn day I get on this app and I realize why I don't want kids. Like, I be thinking I want them, but it's just like, do I really want to go through the chances of looking like this? Because what if her face don't ever go back to this? Like, what if her nose don't go back to that? Like, that's, man.
The society is deliberately lying to women about pregnancy and motherhood, and you cannot convince me otherwise. Because nobody tells women pregnancy is life-risking. According to WHO, in 2023, a woman dies every 2 minutes due to complications from pregnancy or childbirth. Pregnancy can cause postpartum bleeding, placental abruption, amniotic fluid embolism, multi-organ failure, and guess what? Nobody tells women this. And you don't see the warning videos playing at the gynecology office. All you heard is giving birth to a child is a woman's purpose my ass. Before modern medicine, you were basically gambling your life. And not to even mention the permanent damage pregnancy does to a woman is seriously downplayed. Because we're talking about pelvic floor injuries, urinary incontinence, tooth loss, hair loss, uterine prolapse, abdominal separation. A woman's body often never fully recovers after pregnancy. So one of my girlfriends, she got a baby 4 months before, and she told me how she got all the low damage to her body. And she told me, it's nothing serious. It happens to every woman after birth, So she's having this intense postnatal Pilates, to recover her body while working full-time. And I was like, baby, where's your husband? How come he's the one that just there and never got affected? And now women don't want kids or are scared of kids, are labeled as selfish. Now we're just very honest with life.
And this is the exact point of my video. The point is, even if you want to have children, like, have this information. Like, don't go there with the roses and diamonds and I don't even know what it is, the la-di-da thing. Like, and I know the infomercials that show in the delivery room, it's all rainbows and everything. Like, let me tell you this thing. So one of my friends, when I was in Edinburgh, I live in the United Kingdom. So when I was in Edinburgh, I think I just finished my master's degree, and one of my friends from church, she and the husband knew that I didn't want to have children. So I think I had already moved to the city I'm in now, but when they went back there to visit. And then she was now telling me about her birth story. She was like, literally, this lady almost died in this process. Like, she was telling me, I know she was just telling me, like, pointing at her in her heart to me. You know how women talk, we expose everything, we just say everything. And then I was like horrified because I'm like she literally almost died. And this is in UK. We're not talking about Nigeria, because some of the stories, the two other black women there were Nigerians, and that happened in Nigeria. This one is in the UK, Gongon. When she now realized that when she saw the horror on my face, this lady changed it. She was like, but it was not that bad. And I'm like, it's either you want to deceive me or you are deceiving yourself. But somehow, somebody, you're trying to deceive somebody in this situation. But it cannot be me, because even minus her, I know many people. My sister had given birth. My brother's wife has given birth. So I know birthing stories. But I'm like, the women that have gone before us, that was before now, they were hiding all these things. They will not tell us the actual reality of what's happening there. They want to be telling you, oh, it's not that bad, it's not that difficult, oh, this one, just pray. And I'm like, so these other women that were there, were they not praying? They were also praying to give birth like the Hebrew women. That's what the people in the church will tell you to be praying for, to give birth like the Hebrew women. But it's not always that way. But at least I'm so happy. I'm so happy that now women are coming out on the internet to tell us this information, because it is informing our own decisions as well. But we're making informed choices. And the funny thing is, you would think that I'm trying to talk you out of having children, which is not what I'm trying to do, because I promise you that other women will still give birth even after they finish watching this video. So this actually doesn't stop anything. It just gives you all the information. required. This is good. I don't want this video to be too long, so I will use my talk.
Pregnancy can give you cancer. I repeat, pregnancy can give you cancer. Yep, I said it. That's my story. That's what happened to me. Pregnancy gave me cancer. Now, this video is not meant to be ammunition for the girl with the list. I'm sure you've seen her on TikTok. She has more than 300 reasons why women should not fall pregnant. They should not have kids. This is not what this is meant to be. Even though I lost my son, and even though pregnancy did give me cancer, I am still very much an advocate for having children, growing families, because the blessing that it is to have children far surpasses the risks that are involved with pregnancy. Everything in life has risks, but we still do it anyway. Now, that being said, it would be disingenuous of me to not share with you this huge cancer risk that is involved with pregnancy. Who's at risk of it? What is this cancer? It's called choriocarcinoma. Anyone who's been pregnant is at risk of it. It could have been a few weeks. It could have been a full-term pregnancy. It could have been a miscarriage. It could have been an abortion. It could have been an ectopic pregnancy. Or in rare cases, just like mine, a full-term pregnancy and a delivery, and you still can get this type of cancer. Is there a way to prevent it? No. You cannot prevent it. It, unfortunately, is rare, and it can happen to anyone. It is a very aggressive form of cancer. It is a type of gestational disease. There is a kind that happens outside of pregnancy, but in this case, we're talking about the one that happens with pregnancy. It is so aggressive. It can spread very quickly to other parts of your body. It forms initially in your uterus or your ovaries, and it forms from basically placenta cells, where a tumor forms from your placenta, or tumors form from your placenta. It can quickly spread to your chest and to your brain, and then it progresses to stage 1, stage 2, stage 3, or even 4 of this type of cancer. So early detection of this cancer is of utmost importance. It is so important that you get your diagnosis very early. So you can do a blood test, you can do a pregnancy test. When you have high levels of HCG, which is the pregnancy hormone, it means there's a possibility of that, especially if you know you're not pregnant, especially if you've already delivered your child and you're getting high levels of beta HCG, especially if you're bleeding after you've had the pregnancy, you continue to bleed. That's another indicator of this type of cancer being present. If you have abdominal pain, see a doctor, get tested, find out. This cancer is very, very dangerous. One of the reasons why it is so dangerous is because not many women know about it. Not many women are thinking of getting tested after they have their children. Not many women are even thinking about getting tested after they had a miscarriage or had an abortion. So it is very important to spread awareness about this type of cancer. Is it curable? Yes, it is. Early detection, like I said, is very important. When detected early, you're able to get chemotherapy, and the success rate is very high, I hear. That's what I'm hoping for. I'm still going through chemotherapy right now. Very horrible process, by the way. Very, very horrible. Part of the reason why I haven't been able to record this video for a couple of days because I've been sick. But I digress. It is a curable cancer, so get tested. Find out. Don't be a victim. Fertility. Does it affect fertility? Can I still have children after undergoing chemotherapy for choriocarcinoma? Yes, you can. Many people go on to have healthy children after chemotherapy for choriocarcinoma. Of course, it depends on your diagnosis. Discuss your options with your healthcare provider. Discuss your plans also for family. There are alternative methods that people have told me about for curing cancer or for curing this type of cancer. I'm not here to discuss those. The method that I've chosen to follow, with death facing me right in my eyes, is chemotherapy, and I stick to that. If you prefer other methods, by all means, do that. Do what works for you. I'm here discussing chemotherapy for choriocarcinoma. Lastly, thank you so much to all the souls that have shared messages of encouragement with me, of support, of consolation. People who have shared with me the stories of child loss, have shared stories of their cancer journeys. Thank you so very much. I'm encouraged knowing that there are people that are in this journey with me. Thank you so very much. And also to the people that gave donations in the form of money. Through my last video, I've collected almost $200 just in money from strangers to help with covering some of the medical bills. Thank you so very much. You don't even know who I am. You've never met me, but you were able to sympathize with me, empathize with me. and go as far as take money from your pockets, from your children, from your families to donate to me. So thank you so very much. God bless you. May He replenish your wallets. May He bless you. May He bless your families. Continue to do this also for other people. Thank you so very much. Thank you.
If you are a woman of childbearing age, please stop scrolling and listen to me. What I'm about to tell you right now just may save your life. No one knows this, but you can get cancer from pregnancy. And it doesn't have to be a successful pregnancy. This can be an abortion. This can also be a miscarriage. So no one is exempt. If you are of childbearing age, what I'm about to tell you will literally save your life. Please listen. There is a cancer called choriocarcinoma. Choriocarcinoma is a cancer that is developed from pregnancy hormone. Like I said, if you have had an abortion or if you've had a miscarriage, that both involves pregnancy hormones. So just because you haven't had an actual baby does not mean you are exempt from this. A lot of people have miscarriages and they have no clue that they even have them. If you are sexually active, please listen to me. The only thing that you have to do to screen yourself for this cancer is to literally take a pregnancy test. I took a pregnancy test and found out I had cancer before I was able to spread. I took a pregnancy test not because I thought I was pregnant, but because I'm telling you, God told me to take one. And I can confidently say I wasn't doing anything to get pregnant. I took a pregnancy test, and the story time is on my page, but I took the pregnancy test and found out that I had cancer. This particular cancer usually is not found until it starts affecting more vital organs. Until you start to pass out because of headaches, because the cancer is now on your head, or you start to have blood clots in your lungs, or something else catastrophic starts to happen relating to other vital organs. That is just how aggressive and deadly this cancer is. It is a silent cancer, and it is a cancer that is deadly, and it is a cancer that spreads fast. And the only thing that you have to do if you are a young lady, please take a pregnancy test. And I want to clarify, just because you take a pregnancy test and it comes back positive does not mean that it is automatically cancer. But if it comes back positive, it is in relation to something else that is going on. That something else can be a viable pregnancy, it can be a miscarriage, or it can be cancer. This advice will save someone's life. I want to spread awareness for this disease that I had no clue about until I got it. And I would not wish this disease even on my worst enemy. It is the worst type of disease to face. Please, if you are a woman, take my advice, take heed to what I'm saying. It's as simple as buying, maybe a pregnancy test and once a month and taking the test and just giving you that peace of mind. If there's a way that there can be more women saved by spreading this awareness, I'll make a video every day if I need to. So I posted a video about how I was diagnosed with cancer from my pregnancy and how just a simple positive pregnancy test was able to catch the cancer early before it had spread. 99% of those comments came from women. And I suspected that would be the case because we live in a world where when it affects a woman, only women are there for women. I'm not asking for men to stand up and just be in the same space with us, but a pregnancy doesn't just take one person. A pregnancy takes two people. I made my awareness video because I wanted more women to live and more women to survive. And if I could have saved a life, God just knows I'm just so happy and so grateful that I was able to do that just through spreading awareness. But I also want to spread awareness about how important it is to choose the partner that you're with. It's a lot that comes with being a woman, and you shouldn't just be with anyone. You shouldn't just put your energy anywhere. I got cancer from pregnancy, and I almost lost my life. That is a possibility that comes with pregnancy. Though it's rare, it's a possibility. I fought my battle alone. I fought my battle enduring abuse. abuse that I didn't deserve while I was also fighting for my life. My oncologist had also informed me that yes, the cancer is derived from pregnancy, but its origination is actually from sperm. So the father's sperm cell was actually mutated, causing this. My testimony is huge, and I just want to also just let you ladies know that choose wisely who you choose to give children to. Also choose wisely who you choose to be with, because there's a lot of power that comes with being a woman, and there's a lot that you lay on the line when you decide to give your energy to a relationship or to a man, and especially sacrifice your body to bear children. My oncologist told me that there is a huge possibility that if I didn't get pregnant by said person, that this possibly wouldn't have happened to me. So protect yourself, your energy, and don't just be out here giving anybody a baby, okay? There's a lot that can be at risk with pregnancy, and yeah.
Women are being forced to carry tumors, all because these right-wing politicians claim to be Christians and want to pretend they're doctors. Women in Texas have been denied the removal of their molar pregnancies. Now, a molar pregnancy is not a pregnancy at all. It's actually a tumor which can turn into cancer. But because their pregnancy hormones are elevated, the doctors consider them pregnant. And then they have to go through a special board review that no man would have to go through if he had a tumor in his body to remove it. These women sometimes become very ill. They have severe complications with their health that threaten their fertility and their life. And hospitals in Texas are turning women away, telling them, we can't help you. And then if they want to leave the state, Texas is making it more difficult for women to leave the state for reproductive health care. So if they want to go on certain roads, Texas says, if you travel on these roads, we will prosecute you. And if you go to another state to receive care, we want to get your medical records so we can prosecute you when you get back. This is getting out of hand. If a man has any form of cancerous tumor, he's allowed to remove it no matter what. But women are now being put through extra steps and extra hoops to make sure that they're not doing anything illegal. Stay informed about the laws that are being passed in your state, and stay informed about what your rights are if you are in this type of situation and you show up at a hospital. You need to demand that you are treated.
Like, it's so frustrating when every single system has been set up against you as a woman. Because are these not the same people that are crying on online saying the birth rate is declining? But your solution to it was overturning Roe versus Wade, which has now made women to just outrightly refuse. Because look at the situation now. I'm sure the people that were happy to turn over Roe versus Wade, the women that were actually also, because I know women will also vote for this kind of situation. You will not think about the situation because, as the lady said, just being sexually active is enough for you to have this kind of cancer. You don't even need to be pregnant to have this kind of cancer, but your body reads it, has a high level of the hormones that will signal that you are pregnant, but you're actually not pregnant. But because of that high signal of hormones, oh my god, this is so frustrating. They think, okay, you are pregnant, therefore nothing should be done about it, when they can actually tell that there's a cancerous tumor because it's just giving a signal of that particular hormone. You cannot be treated. You have to go and be you have to go to a board to certify whether you are worth them taking out the tumor or not. And cancer, before you know it, it has spread everywhere. And the other lady was like, oh, the faster you get it, the better for you. Only for you to go and catch it fast. But you need to sit down for a board that may not even have medical doctors on that board to decide. It may just be a board of just random nobodies that claim to be politicians or claim to be lawmakers that will be making such decisions for your life. Like, what world are we living in? What world? And they still think that we will want to sacrifice her. I'd rather be celibate for the rest of my life. I'd rather go and be in a convent than to go through something like this. It's just so sad.
Hey girl, are you good? Hi, I'm the girl with the list, and this is reason 282 why I'm not having kids. This is terrifying, but I also want to acknowledge it's also like really fucking cool. But it's terrifying, and I'm sorry this is happening to you, but also you look really fucking awesome. What's actually horrifying about this is that she says it's coming from morning sickness. It's from morning sickness. She popped the blood vessels in her eyes from throwing up too much. This has got to be one of the worst cases of morning sickness I've ever seen. I just know you got it bad, girl. I have seen this happen before with women who pushed too hard when delivering their baby, and that is equally terrifying, but I've never seen it from somebody just from morning sickness. She did say it's not painful, which is good, but it does sometimes feel like there's hair in her eyes, which is a really uncomfortable feeling to be having all the time, and would definitely want to make me like rub my eyes, which I feel like is a really bad idea. I've typed it up. This is now on the list. Thank you so much for your contribution. The list is available on Substack. You can read it in its fullness.
Look at my cute new Yeezy shades. Just kidding, these are from my eye doctor because I just had my pupils dilated because for the past couple of years I've been convinced that I've been going blind, but turns out I'm just a victim of pregnancy and breastfeeding. And while I was pregnant with both my kids and breastfeeding both of them, my body was getting depleted of vitamin E to the point where it was taking it from my eyes, which made my eyesight worse over time. And I was taking prenatals, vitamins, a whole bunch of vitamins. I eat pretty healthy, lots of whole foods. So it wasn't a matter of what I wasn't doing. It's just biology. It's just nature, you know? If your kids need something, they will get it one way or another. So to my breastfeeding moms or anyone that's currently pregnant, just do your best to like keep up with your eye appointments, dental appointments during pregnancy, because there are so many different nutrients that your baby could potentially like deplete from your own body.
Hi, I'm the girl with the list. I'm still not pregnant, and this is reason 296 why I never will be. Listen, I know I said I was going to get to 300 before the app got banned, but then I got depressed. There's a lot of scary shit going on in the world right now, and I did not feel like posting as normal. And on that note, before I go on, I just want to make it clear, in case it wasn't already, that this channel is a safe space for trans people, queer people, people of color, marginalized groups. You are seen, respected, and valued here. And I will continue to be an advocate for the reproductive rights and autonomy for all. All that being said, reason 296 why I won't be having kids.
Show you how sometimes with a C-section, getting the baby out is not easy. And saying that a C-section is the easy way out, please stop. Here we are at time of C-section where the incision has been made on the uterus and the OBGYN is putting their hand in. If it doesn't look gentle, that's because it's not. This is simulating a C-section where the baby is way down low in the pelvis and stuck. See here, the baby's head slips. Sometimes you have to go in multiple times. This is extremely realistic. I've done this and my wrist has hurt for days afterwards. Phew, finally that baby is out. So we do have a tool that can make this a bit easier. A pillow that helps to push the baby up more gently. Right here, as that pillow is inflated, how that baby moves up out of the pelvis.
I don't know why I have this image in my mind of a C-section where the doctors just sort of lift the baby out. No! They're really fishing around in there, scooping the baby out. She said it wasn't gentle. It did not look gentle. Nice that they're still doing research to develop products to make these procedures as easy as possible. And that pillow might make it a little easier, but honestly, my stomach's still queasy thinking about the rest of it. No thank you. Not for me. Take your birth control.
So I am chronically on TikTok. Why I saw a post and someone said, what's the weirdest thing that you've had pregnancy symptom-wise? And she said, I'll go first. Hairy stomach. In my mind, I'm like, that's a pretty common, pretty simple pregnancy symptom. Okay, let me look at these comments. People were like, the discharge, being out of breath. I have a loose anus. I have a loose anus. I'm so sorry, Mom and KJ's family. If y'all are watching this, I don't even care. I've had a loose anus this whole pregnancy. I went to the doctor because I was so scared that I ripped or something because there's just no way. My doctor looked at me and said, actually, this can be a normal symptom of pregnancy with the relaxin your body produces. What? I'm not wearing no white drawers. When I tell you my anus is loose, it is loose. When they tell you things open up, things open up. You don't even gotta go to the bathroom. Every time you wipe, there will be evidence that maybe something is inside of you. A loose anus. Loose anus.
I feel like our feeds have just been like flooded with bad news, so I want to give you more bad news. You know that pregnancy can literally cause cancer? Not like increase, like it can actually like be the cause of cancer. It's called gestational trophoblastic neoplasia. On that same note, pregnancy is more dangerous than any form of birth control on earth. You are more likely to get a stroke, get a blood clot, bleed out, etc. From pregnancy than you are from any form of birth control. More bad news. There is nothing that you can do to prevent stretch marks while you are pregnant. There is no cream, there is no nothing while you're pregnant. It's just your genetics, and you should see a dermatologist after. Pregnancy is going to destroy your pelvic floor. It's going to destroy your pelvic floor. And I'm not just saying like vaginal birth, like even C-section. And if you don't believe me, ask any of your friends who have ever had a baby to cough, and then ask to see their underwear because they peed themselves. That's called stress incontinence. You need a urogynecologist. More bad news. 3 out of 5 women who developed preeclampsia are going to go on to develop heart disease in the future, and up to 70% of people who had gestational diabetes are going to have type 2 diabetes in the future. 35% of counties in the United States are maternity care deserts, meaning that there is not a single birthing center or obstetric clinician for over 1,000 counties in the United States.
This lady said, I don't want peace, I want war. I see your feed is already has so much bad news, but let me just come and give you just some desserts to top it off. The lady is too funny. But I'm happy that she's also sharing this information, because what the is going on here? Do you know the thing that's surprising to me? Is how some man somewhere will say, oh, my wife is not woman enough because she went through CS. She did not do vaginal delivery. Some man somewhere is going to be saying that. Some mother-in-law somewhere was also going to be saying the same thing. You're less of a woman because you did not go through vaginal delivery. We are playing ourselves from all different angles in the world. We're just playing ourselves as women. Those mother-in-laws, those sister-in-laws. Because look at this. The funny thing about cesarean section is it's not every time that you just pop in and be like, oh, I want CS. Especially for the first pregnancy, most women will go with the intention of having vaginal delivery, and it is after they have pushed for hours, then they'll be like, oh, for one reason or the other, is that either your pelvic floor is not open enough, or your cervix is not open enough, or one reason or the other, you cannot go through that route. So you then have to go through CS. So that means you have gone through 2 different procedures to give birth to one same child. And next thing, somebody is somewhere, man or woman, living or dead, come and tell you that you're not woman enough because you went through CS. Did you see how they were fishing for that child in that CS? Not allow them to play you. Yeah, be ready to fight. If you're ready to go down this route, be armed with all this information so that you can be you see this elbow here, you can be jabbing them with the elbow. Anybody that tell you nonsense, because there's some people that are waiting for you. All right, anyhow the child comes, the child has come. As far as you're healthy, the child is healthy. You are still going to get all the symptoms, all the consequences of having children, all the side effects, no consequences. So don't anybody to talk down on you because of your choice or the way you have decided to have your own children.
Hi, I'm the girl with the list. I have more pregnancy rumors than Taylor Swift, and this is reason 265 why I won't be having kids.
Did you know there's an actual disorder that makes it feel like you're having a severe mental health crisis every time you try to nurse your baby?
I think it's about time for us to talk about DMER, also known as dysphoric milk ejection reflex. This is a condition that is estimated to affect around 5 to 9% of breastfeeding people that literally causes extreme depression every time you breastfeed. Newborn babies, on average, need to be fed around 8 8 to 12 times per day. That means if you're within that 5 to 9% range, you're going to be experiencing extreme guilt, sadness, anxiety, low self-esteem 8 to 12 times per day. Sounds like a normal Tuesday. Jokes aside, this is not your regular anxiety, depression, low self-esteem. It's dysphoric. I've been talking recently about how frustrated I am that I feel like women are not being accurately represented in the medical fields. There are a lot of things that just aren't studied about women's bodies, and this is one of those things. Remember when I said that 5 to 9% of breastfeeding people deal with this condition? It's a pretty significant chunk, but I was able to find little to no research on what causes this condition. Further study is needed. Research is evolving. Little is known about the condition. I am so sick about not having answers to the questions that women have about their bodies. And until further research is done, they can't expect women to keep having babies without knowing if our bodies will receive proper treatment when the time comes. And for that reason, I'm out. Take your birth control. I'll see you tomorrow.
A female neuroscientist put herself into an MRI machine 26 times before, during, and after her pregnancy to show what really happens to our brains during pregnancy. You may have heard the term mommy brain or pregnancy brain in the past, but now we have actual proof that something is changing in our brains during our pregnancies. One of the biggest findings of the study is that our brain volume decreases throughout pregnancy. You can see it's mapped here. This is the beginning of pregnancy down to birth, and there's a steady decrease in the gray matter of the brain, about a 4% decrease. Also notice that it doesn't return to baseline in the 2 years after pregnancy. On the other hand, they noticed that the white matter, or the tissue that connects the different brain regions, actually increased during pregnancy. And the good thing is that they're already starting to do more studies based off of this study, so they're going to start scanning more people and seeing if there's a connection between what happens in our brain and experiences like postpartum depression. I also think it's really important that it points out that pregnancy is not health neutral. Pregnancy affects our whole body. The physiology puts us at risk for a lot of things, including now knowing that our brain changes. I think this is a great step forward in really understanding the changes that our bodies go through in pregnancy and what we can learn and improve on in the future.
How? This is the second medical issue. Actually, the third in this video where they are saying, oh, they are just starting the research or the research is still ongoing. Like, what do you mean? Women have been giving birth since the beginning of time. Women have been giving birth since the beginning of time, but we are still looking like we're just even starting to scratch the surface. This lady, pregnant woman, had to even go through this process herself. She has to be the one to test herself to come up with this data, this outcome that we have to talk about in this video. Like, do you understand my frustration? Like, we have been giving birth since. I'm just trying to hold myself back because this is really, really annoying. And this is how they show that they actually don't care about you. The only thing they care about is how the birth rate is going to increase. How it happens, they don't care. They don't care if you end up dying at the end of the day. But as far as this, you have dropped like 2 or 3 before you die. That is what they need for their whole economy to continue to thrive. Literally, that is what they're trying to tell you by not putting enough research into it, because there's some very, very foolish and trivial things that we don't need research into. But the one that is, it's literally somebody giving up their life and their whole human like their whole body to create, and then the man that the man that his contribution to this whole process is pleasure. They will do all the research into him. They'll do all the research. In fact, all the driving tests, all these car tests, all the dummies are male dummies. Even the CPR dummy is a male dummy. It's recently that they brought female dummy so that people can practice CPR on women. Literally, we are half of the population. How come it is the video? She made this video in 2024, September 2024. That is when literally this lady has to go into the MRI machine, which is not even really healthy for a child. Like, it is just too clear that they don't care about us, and I'm just hoping that we finally see that these people don't care. It is all just propaganda. Please really look into this and to make sure that it is something that you really want to do and not just you being socially conditioned to want to do it. You understand? Because sometimes you may do something because you think you want to do it, but by the time you sit down and really think about it, you just realize that, oh, we're just socialized to do this. Because when you talk about babies, female children and male children, when they're giving them toys, they just give the female child the baby. Automatically, they give the female child the baby. You're not giving the male child the baby. Do you understand? That's just a slight example, a small example of what I mean by socialization. When you have a younger person, that like a younger sibling, there's a male and there's a female older sibling. Usually it's the female sibling that is responsible for that younger sibling. Do you understand what I mean? So these are, but in your mind you'll be like, oh, I actually enjoy it. But if you sit down to really think about it, some of these things may be just social conditioning, that it just it's just in your socialize in the way you've grown up, that you actually think that, oh, it's something you want to do. But when you sit down and think about it, it's not actually something you want to do. At the same time, some people actually want to do it when they have to finish thinking about it. So I want to give space for that as well. And also something that we need to know, the birth statistics I gave you at the beginning of this video. Just know that statistics also maybe even doubles if you are a woman of color, you're a black woman, Asian woman, regardless, Native American. Know that number of maternal deaths increases if you are a woman of color. And it doesn't matter how rich you are, how poor you are, it really does not matter, because even Serena Williams had the goat Serena Williams had a similar experience when she was giving birth to her child. Let that sink in. It doesn't matter if you're a celebrity, it doesn't matter who you are. They will second guess you, like they will second guess whether they should give the same level of treatment as somebody that's not a person of color. So all these things have an intersection. Like it all combines to give you like a bigger picture of what situation you actually are in as a woman, and especially as a woman of color. And I'm going to play this video, and it is going to make you to really, 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 really think about things.
I am going to share a story that I've thought about sharing a gazillion times since I've been on social media. I think today's the day. So I was in medical school from 1996 to 2000. When I was in my third year OB rotation, back then, all the patients delivered in the OR. Vaginal delivery, C-sections, they all delivered in the OR. And I remember going back for a delivery. Black patient. This was her fourth or fifth delivery. Delivered seamlessly, not an issue. And I remember it was me, the faculty, and a resident. Don't remember what year the resident was, doesn't really matter. But after the patient delivered, the faculty looked at the resident and said, "Have you repaired a 4th degree laceration yet?" And the resident said no. So, hold on. So, the faculty got a pair of scissors. Okay, the faculty got a pair of scissors, and he put one blade in the vagina and one blade in the rectum, and he cut a 4th degree in a patient who had already delivered. Now, I was a medical student. I didn't know if that was what was done and that's how they trained residents. I don't even think it even computed with me what was happening and how wrong it was, obviously, until I got more training and became a resident myself and realized what had actually happened. There's a lot of things that happened back then that we were made a party to because of the practices and obstetric abuses that were commonplace, and we couldn't say anything. We couldn't say anything. And although I will never know what it's like to be a Black pregnant individual in this country, I can educate myself and understand and teach and learn some more and bring awareness and do better as a physician and as someone who's teaching future physicians.
So, in many ways, I do treat my Black patients differently because of what I know and I have learned. I have not experienced, but what I know and what I have learned has happened to them in healthcare since Joel Marion Sims. I make an active effort to make any situation I'm in a safe place for my Black patients because I care and I try to learn from them. And they actually teach me. But I can't be taught if I don't ask. So I ask. The fact remains that the reason why Black patients in this country have the highest rates of maternal morbidity and mortality are largely due to racism, both within the individual providers and with the systems. It's not because of any biological differences in their bodies or their anatomy or their physiology. It's due to the fact that when they hit the door, they're not set up to receive equal and equitable health care because of the tone of their skin. And if you don't believe that, just hear this one little fact. Black pregnant patients with a college education still have a 5-fold increased risk of maternal morbidity and mortality over their white counterparts. So if you are an obstetrical care provider or you're becoming one, we just had Match Week, make sure, if you need it, educate yourself. Learn, talk to your patients, read, follow accounts that are educating on this topic if you're on social media. There are plenty of ways that we can arm ourselves to better take care of our Black patients. And with everything that's going on politically in this country, the risk to them is even greater.
When you decide to have a child through pregnancy, essentially, especially when you're a Black woman, you're also deciding that you're risking your life to carry it. Like, I could die. Pregnancy is one of the most vulnerable and dangerous positions women can be in. And unfortunately, men are aware of this, which is why for most women, the first time they're ever hit, the first time they're ever slapped, the first time they're ever punched, the first time they're ever spit on is while they're pregnant, often during their 3rd trimester. All of this is for a reason, because we understand the vulnerable position that women are in when they are pregnant. Now, the American College of Obstetricians and Gynecologists, also called ACOG, says that 1 in 6 abused women is first abused during pregnancy. More than 320,000 women are abused by their partners during pregnancy each year. Now, there's an article by the British Columbia Reproductive Care Program, a 23-page article called Intimate Partner Violence During the Perinatal Period. It states here, violence may begin and or escalate during pregnancy, or it may diminish. Of the Canadian women who reported being abused by a marital partner during pregnancy, 40% said that the abuse began during pregnancy. Some studies have shown other patterns during pregnancy. For example, in a study of 199 abused women, 18.1 of the women were abused during pregnancy, but not the year before. Yes.
I think the only thing this shows us is how we need to position ourselves in this world that is a patriarchal world, showing that men know that you are in a vulnerable position when you are pregnant. Like, the most vulnerable position you can ever be in as a woman is that's the time when they want to start having physical violence against you. Like, it is like my skin is, I'm having goosebumps just listening to that, to those statistics this lady is talking about. And then at the beginning of the video, I gave you a statistics of 209 people, 209 women dying of childbirth, just biological reasons, and it's increasing to 294 or 95 people in the next 4 years after that. But, and I also told you that if you're a person of color, that number doubles. At the same time, all those numbers put together, the number one cause of death of women that are pregnant is violence, is domestic violence, is death, like somebody killing them. So if you're not facing economic issues why you cannot why the birth rate is declining, or why women are not giving birth, you're facing the biological or the physiological issues why you're not giving birth, or even racism as well in the hospital as a person of color, and then you're also facing domestic violence at home. Like they just want to cook us from all different angles. But that's the end of this video. Please let me know your thoughts and comments in the comment section. My next video is going to be about the social reasons why the birth rate is declining, which includes domestic violence. It also includes all the burdens that women have to go through, especially in this century that we're in now, with all the changes that have happened, and femicides and all that. I'm going to cover it in the next video on the social reasons why the birth rate is declining. Please do well to subscribe, like, share your comments in the comment section, and I'll see you in the next one. Bye.